Early detection can help save lives, especially when it comes to heart-related problems. Dr. Jack Hauser, founder of Heart Care Associates of Connecticut, is joining us to tell us more about some new groundbreaking tests for heart issues and how people may live longer because of them. Doctor, thanks so much for being with us.
Thank you for having me.
So tell us about this new test. This is a life-saving test. It's very innovative, and it's only been around for a few months.
Right. This is known as the endothelic VENDYS test. And essentially what it does is it calls upon some very new ideas in cardiac physiology. And it applies what we know now about what causes heart attacks and strokes. Now imagine that if we can perform a test that takes less than 15 minutes in the office on a patient who is completely relaxed, does not need to do any exercise, and I can have an answer for that patient about whether the process of plaque formation and atherosclerosis has already begun, then it gives me a window into that patient and we can begin preventive measures.
Can you tell us exactly how the testing is done, how it's administered?
Yes. Essentially, it is based upon occluding blood flow temporarily for 5 minutes by a blood pressure cuff in one arm compared to the other arm.
Okay.
The temperature of your blood falls as the flow of blood diminishes, and when we release the cuff, we measure how quickly the return of the temperature is in your capillaries in your fingertip. If there is a less than optimal response, that gives us a very good indication that you may have what we call endothelial dysfunction, and that's a very fancy term for saying atherosclerosis is probably present in your body.
Okay. Now, before this test, possibly would you say a full body scan would be something that maybe people would have considered if they wanted to sort of have a comprehensive look of their body's health?
Well, that's a very, very interesting question, and I think it gets to the heart of the problem, no pun intended. Scanning, whether it's whole body scanning, nuclear scanning, CAT scanning, angiographic scanning, is really what we rely on today. And much of healthcare, how we practice today, is technology driven. Unfortunately, it's not perfect. It's invasive. It involves exposure to radiation, and it's very expensive. So by employing a very simple office-based test, we can actually circumvent the use of such procedures and not only have a better approach to the patient, but save a lot of money.
Body scans are very expensive and really not covered by insurance. It's elective. But this new test is covered by insurance? It
is covered by insurance, and I think that suggests to us that those that pay our bills, that pay us, realize how valid, how legitimate this testing is. It is not a gimmick. It works, and it's very useful.